Well, Rebecca, this all depends upon your age, really, as I mentioned earlier in this program. First place, I don't like Clomid and Femora. Femora is just another name for letrozole. Uh, Clomid is great drug for getting quality eggs, but it has a temporarily negative effect on your uterine lining. So it's great in conjunction with IVF, but it's not great just without IVF. Femora is a very popular drug, which I think is really stupid. It's great for breast cancer. That's what it's meant for. What it does, it's an aromatase inhibitor that prevents the testosterone in your ovary from being metabolized into estrogen. So instead of having estrogen in the granulosa cells and in the follicles of your ovary, you got male hormone, testosterone. Well, the idea of it is to try to fool the pituitary gland into thinking you have less estrogen, so the pituitary makes more FSH. Pretty stupid concept, actually, because really what's happening is that you're building up all this testosterone inside your ovary, a male hormone, and that's not really good for the ovary. So February results are terrible. It's become an extraordinarily popular drug, but that's just because drug company advertising is so effective, and because many of the doctors that prescribe it really aren't very scientific, and they didn't graduate from the top of their medical school class. And so I mean, this combination of Clomid and Provera and Femora was not going to work. Now, I don't know your age, but if you're 35, like I said before, it's time to do IVF, and I would do Mini-IVF, of course. But if you're really young and you're in your 20s, then okay, you can try lesser medications. But when you've already tried something lesser that isn't very effective, the real dilemma people get into is trying to avoid IVF and trying to take less extensive treatment while their eggs are getting older so that their results when they eventually do go to IVF are going to be less. That is the dilemma. You just mustn't put that off for too long. It's not an urgent rush, but you're not really going to get pregnant with that PCOS. It's so hard to budge the needle, so and you don't have natural periods. Let me explain what it really is, because a lot of doctors as well as couples are confused by it. It stands for polycystic ovary syndrome. And 70 years ago, when we had no ultrasound or hormone assays, about 1 in 1,000 patients with PCOS would be extremely obese and have very oily skin. And those were the extreme cases, and it was called Stein-Leventhal syndrome. And so it was thought to be some kind of a peculiar metabolic syndrome and maybe related to obesity or hirsutism. Now, sometimes that occurs, but the vast majority of PCOS is nothing like that. The vast majority of the women are thin and they're young, but they just have too many eggs, which sounds confusing. You'd think that would be a benefit. And in fact, those women with PCOS will undergo menopause much later in life. Instead of the average age of 51, it might be age 60 or 65. Because it's nice to have too many eggs, but the problem is you're trying to get pregnant, and all those eggs inhibit the FSH secretion in the first part of the cycle. And as they inhibit the FSH secretion in the first part of the cycle, you do not recruit a dominant follicle. And so you either ovulate later, you don't ovulate, and you never have that beautiful synchrony of the 14 days to ovulation and the 28 days till the next menstrual cycle, because you didn't begin it right by recruiting a dominant follicle. So the treatment for this, if you want to get pregnant now, frankly, is to go to IVF, but I'd only do Mini-IVF, because the danger of ovarian stimulation with PCOS for IVF is massive hyperstimulation. You could get extremely ill, very sick, because the ovaries have so many eggs, they get huge. You will absorb a lot of fluid into the peritoneal cavity from the peripheral blood supply. You'll get dehydrated despite your abdomen being like that. And it's a very dangerous condition, hyperstimulation syndrome. And that's typical with PCOS patients that get stimulated. So it's very important to do Mini-IVF for those patients, and also not to trigger with HCG, but to trigger with Lupron. We really won't get hyperstimulation syndrome anymore with any patients, including PCOS patients, because of Mini-IVF and Lupron trigger. It's very, very, very safe. So you should go to IVF now. I mean, that's the only way you're going to get pregnant, and take advantage of the fact that your eggs are so young. But that's what you should do now.